Assalamu alaikum. I am Nimra Shakir. Today I am talking to you about Lisinopril. These are all my group members. So first the introduction of Lisinopril. Lisinopril belongs to a group of medications called ACE inhibitors. ACE stands from angiotensin converting enzyme. Angiotensinogen is secreted from the liver and it becomes angiotensin 1 by renin from the kidneys, and then the enzyme ACE converts the angiotensin 1 into angiotensin 2. This enzyme coincidentally also breaks down bradykinin. Both of these function of the enzyme ACE actually increases the blood pressure. So angiotensin 2 directly or indirectly increases the blood pressure by aldosterone or other mechanism. And the other one is bradykinin. Bradykinin is a vasodilator which decreases the blood pressure by ACE. So if we block the ACE, we will decrease the blood pressure and nothing break bradykinin. So these inhibitors work by widening blood vessels, reducing stress on the heart, and making it easier to pump blood around the body. Lisinopril also increases life expectancy by helping it to prevent further heart attacks. But the main use of ACE inhibitors is hypertension, especially in the presence of diabetes or congestive heart failure. So next, the history of lisinopril. Lisinopril first evolved and synthesized at Merck in 1987. It was made to replace the first ACE inhibitor captopril. Captopril is also an angiotensin converting enzyme inhibitor, but due to its side effects, severe side effects, we replace it. As you see in the table, its name also shows its severe side effects. So, since receiving FDA approval, it has grown to become one of the most frequently prescribed antihypertensive medications worldwide.
Assalamu alaikum. My name is Muskan Tahir and I am going to explain about the chemistry, pharmacokinetics and pharmacodynamics of lisinopril. Starting with the basic chemical and physical properties of lisinopril, the chemical properties includes its molecular formula, its constituents, whereas the physical properties includes its color and solubility, etc. Chemically, lisinopril consists of the two amino acids, that is proline and lysine. So it is a dipeptide and also known as lysylproline. The upper portion containing ring is proline, and with proline the structure of lysine is attached. In addition to these two amino acids, it is also contain phenylbutyric acid, which is attached by the alpha amino group of lysine. Its molecular formula is C21H31 and 3O5, and it contains the levoproline and levolysine group. Its physical properties includes its form and color. It is in the form of the crystalline powder, and its color ranges from the white to off-white. It is soluble in water and relatively insoluble in ethanol, acetone, chloroform, etc. Moving on to the pharmacokinetics of the lisinopril, as we all know that the pharmacokinetics is the action of body on the drug, which includes its absorption, biotransformation, elimination, etc. Lisinopril is an oral medication which has rapid absorption in human, and it has low first-pass metabolism. As we all know that the first-pass metabolism is the phenomena in which drug get metabolized at a specific location in the body before reaching to its targeted site of action or systemic circulation. Within 6 to 7 hours, it reaches to its maximum plasma concentration because of its rapid absorption through GIT after oral administration. It has low bioavailability, that is ranging from 10 to 30%. This is because of its no binding with the plasma proteins, as it is an active drug, which means that it does not need any bioactivation, so it is eliminated in the urine without any changing. It can remain in our body for 24 hours, so its dose is once per day and its half-life is 12 hours. Moving on to the pharmacodynamics of lisinopril, as we all know that the pharmacodynamics is the action of drug on the body. So lisinopril acts on the ACE enzyme. Here a question arises that what is an ACE enzyme? For this concept, we have to look on the flow chart present on the right side of the slide. In this flow diagram, one of our main excretory organ, that is kidney, is shown. Besides from its excretory function, kidney also releases an enzyme known as renin, which converts the angiotensinogen into angiotensin 1, and angiotensin 1 is converted into the angiotensin 2 with the help of ACE enzyme. Angiotensin 2 has different functions like vasoconstriction, increased blood volume, and renal sodium and fluid retention. This is done by its binding with the angiotensin receptors that are present on the vascular smooth muscles and renal tubules. There are two types of angiotensin receptors, that is AT1 and AT2. AT1 receptors are more important in increasing the blood pressure. Here you should not confuse the AT2 receptors with the angiotensin 2 because it is the subtype of angiotensin 2 receptor on which it acts. Vascular smooth muscles work by G-protein coupled receptors in which calcium is involved, whereas renal tubules got the signals from the pituitary gland and adrenal cortex to increase the ADH and aldosterone secretion respectively, which causes the sodium and fluid retention. So when lisinopril inhibits the ACE enzyme, it results in the reduction of blood pressure as well as the aldosterone secretion and sodium reabsorption. As we know that angiotensin II is a strong vasoconstrictor, so when lisinopril acts on it, it causes the relaxation and widening of the blood vessels, resulting in more blood flow through it, as a result of which blood pressure is reduced. In the next point, sodium and water retention is discussed. As we know that the ADH causes the reabsorption of water and aldosterone causes the reabsorption of salt in collecting ducts. So when its concentration is reduced, sodium reabsorption is also decreased. So as a result, we can say that aldosterone regulates the fluid and electrolyte balance. By the end of this slide, we can conclude that the lisinopril has inhibitory effect on the ACE enzyme, which causes the lowering of blood pressure.
Assalamualaikum, my name is Saira Said. I'm gonna discuss about the drug-drug interaction, the side effects and the clinical application of the lisinopril. Now first start with the drug interaction. One of the important drug interaction is observed with the NSAIDs, which are the non-steroidal anti-inflammatory drugs. Many of the NSAIDs can produce the renal failure because they are going to decrease the glomerular filtration rate. So here the lisinopril can also increase the renal failure. So whenever the NSAIDs are given along with the lisinopril for a longer period, they can produce the severe renal failure. Similarly, if you have the drugs which are acting on the renin-angiotensin system like the RBs, angiotensin II receptor blockers and the renin inhibitors like the aliskiren, all these types of drugs are going to produce the hypertension and they are used as antihypertensives, and lisinopril can also produce a hypertension by inhibition of the renin-angiotensin system. So when these drugs are combined, they can produce the severe hypertension because all these drugs are going to inhibit the renin-angiotensin system. That's why these drugs should be avoided with the lisinopril. The next one is the lithium. What is the action of the lisinopril on the lithium? We already discussed that the lisinopril is going to inhibit the angiotensin in two actions, thereby decrease the sodium reabsorption. So when this drug is given, it can increase the sodium excretion. When the sodium is more excreted, the lithium is more retained. So lithium excretion is somewhat reduced because sodium and lithium are monovalent. So lisinopril can increase the lithium toxicity. So the dose of the lithium should be somewhat reduced in order to prevent the toxicity. Similarly, diuretics. Normally, lisinopril can be combined with the diuretics like the hydrochlorothiazide, but these diuretics can also reduce the blood pressure. So, lisinopril can also reduce the blood pressure. So, when this drug is given along with the diuretics, a sudden fall in the blood pressure can be observed. So, when this drug is given to the patients who are already taking the diuretics, lisinopril should be administered after the stopping of the diuretics, and then slowly diuretics can be combined with the lisinopril after few weeks. By this type of administration, we can eliminate the sudden fall in the blood pressure and syncope in the patient. The electrolyte imbalances or additive effects on the blood pressure can also result from these interactions. Now, if we talk about the side effects, the important side effects is the renal failure because the renin-angiotensin system is associated with the renal system. So, if any drug inhibiting the renin-angiotensin system can produce an effect on the renal system. So, here lisinopril can produce the renal failure, thereby it can reduce the potassium excretion resulting in the hypercalcemia, which is the high blood potassium level. And since the renal function is somewhat reduced, lisinopril can also increase the serum creatinine level, which should be thoroughly checked when this drug is intended for the long-term use. And the second important effect is the related with the bradykinin. This bradykinin is going to be converted into its metabolite by one of the enzyme which is having the ACE-like action. Now, lisinopril can inhibit this ACE-like enzyme activity, thereby it can inhibit the conversion of the bradykinin into its metabolites, which result in the accumulation of the bradykinin within the plasma. So, when the bradykinin levels are gonna be increased, immediately produced, we have the effects like the dry cough. So, dry cough is one of the important side effects produced by the lisinopril, and this bradykinin can also produce a vasodilation and edema, thereby can increase the angioedema. So these are the two important side effects of lisinopril which are attributed to the accumulation of the bradykinin and other eicosanoids. The other important side effect is the hypertension. Since this drug is acting as an antihypertensive agent, so it can produce the hypertension as it is going to reduce the blood pressure. So this hypertension is more pronounced in the patient with the heart failure because in the heart failure there is a decreased force of contraction, decreased cardiac output. In this situation, lisinopril can further decrease the blood pressure by inhibiting the ACE enzyme. Similarly, angioedema is the another important effect. We already discussed this. Angioedema is because of the accumulation of the bradykinin and other mediators. So when lisinopril is given, the patient can observe the angioedema resulting in the swelling of the lips, face, tongue and larynx. Sometimes intestinal angioedema can also be observed, which may result in the abdominal pain. We have some common side effects also which involve the dizziness, headache, cough, nausea, vomiting, diarrhea, fatigue and the skin rashes. So if any of these symptoms are observed within the lisinopril, immediately the drug should be stopped as these symptoms become more troublesome in the patient. Now, if you talk about the clinical application, as my fellow already discussed about it, lisinopril mainly used to treat hypertension, diabetic neuropathy, heart failure, post-myocardial infarction.
Assalamu alaikum. My name is Muhammad Nabil Khan Niazi, and now I will tell you about some of the contraindication of the lisinopril. Lisinopril is contraindicated in the patient who are hypersensitive to this drug or the allergic to the ACE inhibitor, and also for those patients who have a history of angioedema, because lisinopril can increase the risk of angioedema during the pregnancy, and lisinopril also contraindicated because it can cause harm to the fetus, especially during the second and the third trimester, and even cause the death of the fetus. In bilateral renal artery stenosis, lisinopril is contraindicated because it decreases the renal blood flow and disrupt the kidney function. Next is the dose recommendation. For the normal patient, the initial dose is 10 milligram per day, but it can be increased greater than 40 milligram according to the condition of the patient. But for the heart and the renal patient, 2.5 milligram once a day use. And for the treatment of the hypertension, the initial dose is 10 milligram, but it can be increased up to 20 to 40 milligram according to the condition of the patient. And next is resuscitation. Resuscitation may be required in the event of the lisinopril overdoses or the severe adverse reaction. As the lisinopril has small molecular weight and low protein binding, so it cannot easily remove to the bloodstream through hemodialysis and become overdose. If the overdose is recent, activated charcoal may be administered to assist in reducing absorption. And next is the interesting fact of the lisinopril. Lisinopril may have neuroprotective effect and may useful in the treatment of the neurodegenerative disease like Alzheimer. In animal model of Alzheimer disease, research has demonstrated that lisinopril can reduce the inflammation in the brain and improve in the cognitive function. But in order to measure these potential factors in the human, additional research is required. Now, the last slide of our topic are the brands. There are three major brands of the lisinopril, such as Premium, Zestrin, and Lisinopril. So that's all from our side.